Hey guys, this video today is, I've gotten some people who have had like recent diagnoses of bipolar or a form of bipolar, and they've told me that they don't really know the difference between 1, 2, and whatever else is there. And I just felt like I just wanted to help people understand the difference between the different types of bipolar. And I actually have this book right here. This is not my book, but it's the desk reference to the diagnostic criteria from DSM-5. And yes, I'm going to read out of this book. I do not own the rights to this information. This is coming out of this book. And these books can be very expensive, and you can't always trust the information on the internet. So I'm gonna take from this book so you guys can understand and know the difference between the disorders of bipolar. And what was I gonna say? Oh, this particular DSM-5 is not going to be used until October of this year. Now, they may change the date, but until October, as of right now, the diagnoses come from the DSM-4. So I just keep that in mind. So this video is going to be bipolar 1, and then I'm going to make a separate one for bipolar 2, and so on and so forth. So forgive me if I'm looking down because I'm reading out of this book. Okay, excuse me. All right, here we go. Excuse me. Bipolar 1 disorder. For a diagnosis of bipolar 1 disorder, it is necessary to meet the following criteria for a manic episode. The manic episode may have been preceded by and may be followed by hypomanic or major depressive episodes. Manic episode. A distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased goal-directed activity or energy, lasting at least 1 week, 7 days, and present most of the day, nearly every day, or any duration if hospitalization is necessary. B. During the period of mood disturbance and increased energy or activity, 3 or more of the following symptoms, 4 if the mood is only irritable, are present to a significant degree and represent a noticeable change from usual behavior. 1. These are the symptoms of a manic episode. 1. Inflated self-esteem or grandiosity. 2. Decreased need for sleep. Example, feels rested after only 3 hours of sleep. 3. More talkative than usual or pressure to keep talking. 4. Flight of ideas or subjective experience that thoughts are racing. 5. Distractibility, i.e., attention to easily drawn to unimportant or irrelevant external stimuli as reported or observed. 6. Increase in goal-directed activity, either socially, at work or school, or sexually, or psychomotor agitation, i.e., purposeless, non-goal-directed activity. 7. Excessive involvement in activities that have a high potential for painful consequences. Example, engaging in unrestrained buying sprees, sexual indiscretions, or foolish business investments. Okay. C. The mood disturbance is sufficiently severe to cause marked impairment in social or occupational functioning, or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features. D. The episode is not attributable to the psychological effects of a substance. Example, a drug of abuse, a medication, other treatment, or to another medical condition. Note, a full manic episode that emerges during antidepressant treatment, example, medication, electroconvulsive therapy, but persists at a fully syndromal level beyond the psychological effect of that treatment, is sufficient evidence for a manic episode and therefore a bipolar 1 diagnosis. Note, criteria A through D constitute a manic episode. At least one lifetime manic episode is required for the diagnosis of bipolar 1. Hypomanic episode in bipolar 1. A distinct period of abnormally and persistently elevated, expansive, or irritable mood and abnormally and persistently increased activity or energy lasting at least 4 consecutive days and present most of the day, nearly every day. B, during the period of mood disturbance and increased energy and activity, 3 or more of the following symptoms, 4 if the mood is only irritable, have persisted, represent a noticeable change from usual behavior, and have been present to a significant degree. Okay, so it's the same, they're the same as the symptoms I just mentioned before. C, the episode is associated with an unequivocal change in functioning that is uncharacteristic of the individual when not symptomatic. D, the disturbance in mood and the change in functioning are observable by others. E, the episode is not severe enough to cause marked impairment in social or occupational functioning or to necessitate hospitalization. If there are psychotic features, the episode is, by definition, manic. F, the episode is not attributable to the psychological effects of a substance, example, a drug of abuse, a medication, other treatment. Note, a full hypomanic episode that emerges during antidepressant treatment, example, medication, electroconvulsive therapy, but persists at a fully syndromal level beyond the psychological effects of that treatment, is sufficient evidence for a hypomanic episode diagnosis. However, caution is indicated so that 1 or 2 symptoms, particularly increased irritability, edginess, or agitation following antidepressant use, are not taken as sufficient for diagnosis of a hypomanic episode, nor necessarily indicative of a bipolar diathesis. Note, criteria A through F constitute a hypomanic episode. Hypomanic episodes are common in bipolar 1, but are not required for the diagnosis of bipolar 1 disorder. Major depressive episode, bipolar 1. A, 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either 1, depressed mood, or 2, loss of interest or pleasure. Note, do not include symptoms that are clearly attributable to another medical condition. So here are the symptoms. 1, depressed mood most of the day, nearly every day, as indicated by either subjective report, example, feels sad, empty, or hopeless, or observation made by others, example, appears tearful. Note, in children and adolescents can be irritable mood. 2, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day, as indicated by either subjective account or observation. 3, significant weight loss when not dieting or weight gain, example, a change of more than 5% of body weight in a month, or decrease or increase in appetite nearly every day. Note, in children, consider failure to make expected weight gain. 4, insomnia or hypersomnia nearly every day. 5, psychomotor agitation or retardation nearly every day, observable by others, not merely subjective feelings of restlessness or being slowed down. 6. Fatigue or loss of energy nearly every day. 7. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concentrate or indecisiveness nearly every day, either by subjective account or as observed by others. 9. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. B. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. C. The episode is not attributable to the psychological effects of a substance or another medical condition. Note, criteria A through C constitute a major depressive episode. Major depressive episodes are common in bipolar I disorder, but are not required for the diagnosis of bipolar I disorder. Note, responses to a significant loss, example, bereavement, financial ruin, losses from a natural disaster, a serious medical illness or disability, may include the feelings of intense sadness, rumination about the loss, insomnia, poor appetite, and weight loss noted in criterion A, which may resemble a depressive episode. Although such symptoms may be understandable or considered appropriate to the loss, the presence of a major depressive episode in addition to the normal response to a significant loss should also be carefully considered. This decision inevitably requires the exercise of clinical judgment based on the individual's history and the cultural norms for the expression of distress in the context of loss. So it says here, bipolar I disorder, A. Criteria have been met for at least one manic episode, criteria A through D under manic episode that I previously read. B. The occurrence of the manic and major depressive episode or episodes is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorder, another psychotic disorder. Okay, so that is what this book says for the criteria. For the criteria of a bipolar I diagnosis. So I'm going to leave that here, and I'm going to go on to talk about bipolar II. Sorry, my phone fell. All right, I'll see you in my next video.